Babies under 3 months are relying on instinct and reflex to suck and swallow. Reflexes are pre-wired motor programs in the brain that when you do certain actions, something else happens. So in the case of infants, their sucking and swallowing is reflexive. If you put something in baby's mouth, they will suck on it, and if there's a certain amount of liquid, they're obligated to swallow. This is a pre-wired program for the first 3 months to teach baby how to suck and swallow. Around 3 to 4 months, these reflexes integrate because they should have learned how to volitionally suck and swallow. So suck training exercises that we use for young babies to help with tongue ties can work really well for the first 3 months. But somewhere around 11 to 14 weeks, those reflexes are supposed to integrate and the baby is supposed to know volitionally and get to choose how they want to suck and swallow. From around 3 to 4 months, the reflex now turns to chewing, where you put something in their mouth and they instinctively and reflexively want to chew. This helps them prepare for the next step of development, which is solid foods. So if you've been trying to do suck training exercises on your baby over 4 months and they're refusing, it's because you're focusing on the wrong thing. Instead of focusing on sucking, we actually want to focus on chewing, and these skills will carry over to suck. You may have seen in my videos for suck training, I'll do lots of different movements inside the mouth to try to get the baby to reflexively respond. You touch the tip of the tongue should follow coming out of the mouth. You touch the side of the tongue should move to the side. You'll often also see me touch the molar surfaces at the back and you'll see a reflexive bite. For young babies, babies don't need to bite, but this primitive reflex is programmed in to then kick in around 3 to 4 months when we now want them to chew. So even though that reflex isn't used as a newborn for sucking and swallowing, that pre-program, that template is there for when they're ready to mature and transition to the next stage. Now, young babies, when you rub their gums, may trigger a bite reflex. And this is what can cause some pain when you're trying to latch. You rub your nipple along those gums and the reflex says bite, 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 which is why we want to be really careful of how we're focusing on our latch technique. When we're crossing over the 3 to 4 month mark, we can now use that bite chewing reflex to get the baby to now work on chewing skills, to get the tongue to move side to side, in and out and up and down, and work those jaws. Because as we strengthen and coordinate the tongue, those skills then transfer over into sucking. So if you've been trying to do suck training exercises and they're not working for your older baby, it's time to focus on chewing. When we're talking about chewing, we can use different textures to our advantage. We want to have a baby who's 3 to 4, 5 months old, putting their hands in their mouth a lot. By having their hands or toys or tools in their mouth, they're learning the dimensions of their mouth, the borders, which is an important skill for when they start solid foods. By having their hands and exploring the dimensions of their mouth, it gets them ready to figure out what is going to be too big to put in their mouth and what is going to be just right. We can also use very specific tools and toys for the baby to also help learn this. So by giving them things like a baby chewy pea, an arc grabber, a Beckman Tri-Chew, or O-balls, the baby gets different exposure to different textures and sizes and lengths to figure out the borders and dimensions of their mouth. The tongue also is doing lots of exploration in different directions to work on range of motion, strength, and coordination. So in this next video, you'll be seeing me working with a 4-month-old with some different textures working on chewing. So when we have a 4-month-old, suck as a reflex is integrated, so that no longer applies for suck training. So now we focus on chewing. So to chew, a bunch of different stuff we can do. We're going to ask, now I like the hands in the mouth, that's good, but I'm going to see if I can come in. Can I come in? Oh, thank you. I'm going to turn my finger over and put it up on the molar surface, and I want to see that tongue move to the side like Bennett says, hi. And then we're going to go on this side, and we want to practice chewing, because that's going to get the tongue engaged. Now, if you don't want to use your finger, you can use a clean washed finger. We can try with the pacifier. This is a nice long pacifier. Hi, we're going to put it on that. Can you chew, chew, chew for me? Because we can just use what we have. Chew, 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 chew. That's good chewing. And then we're going to go on this side. Can we chew, 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 chew? Yeah. See, we're just distracted by how pretty mommy is, aren't we? Yeah. Now, if he'll suck for us, great. Let's see. Will you suck for me? Maybe a little bit. Because you can also, if your baby's willing to suck, you can do a little bit of pulling on the pacifier.
Okay.
To try to get the baby to suck that pacifier in and stay in. Now, at 4 months, he's like, I'm over it. I want to chew. I don't want to suck. But if he's willing, you would just get him to suck and then do a little tug of war. Tug, 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 tug. I'm trying to take that pacifier.
Sometimes he wants to suck to go to sleep, and sometimes he doesn't.
Yes. So at this age, he gets to choose. So to do it as an exercise, if he's willing to engage, you make it fun. But you're saying no thanks. No thanks. Should we try something else? Do you want to try the O-ball? No, I love a good O-ball at 4 months because they can grab it themselves. Hi. And what you want to see them do is try to get it in their mouth and wrap that tongue around the little bars. Great. Something like this too. Anything, there's the Manhattan toy that's an O-ball that kind of is the hybrid between these two, but anything that's going to have like long bars and different textures that they can grab onto and bring to their mouth. What the goal is at this age is to get the tongue to go in and out, side to side and up and down, so they learn the dimensions of their mouth. And just like that, you're doing such a good job. So I know. So it's a balancing act between you leading the exercise and the baby doing it independently. Because the more you're working on that tongue moving in every direction, the stronger it gets. Now I can come in because we're kind of playing. I'm going to touch the tip of his tongue and see if it'll follow me. I'm going to touch the side and see if it will come into the side. Now I'm going to come in the cheek, see if he'll move it in the cheek. I can put my finger in his cheek and see if he'll squeeze my finger into his mouth. Sometimes you'll see the tongue move, or you'll see the cheeks kind of squeeze to try to get my finger in. If he gets bored or uninterested, you stop and you change it. So the goal at this stage is exploration and interaction. Hi, are you done? Oh, okay. And when the baby says they're done,
Probably needs a burp.
you stop. If you have any concerns about your baby's oral motor skills, please find a qualified IBCLC lactation consultant, pediatric, occupational, physical, or speech therapist in your area to work with you. These exercises are not medical recommendations. These are general guidelines that many parents have find helpful for working with their babies. As always, like and subscribe, and if you have more questions, feel free to email me at lalactation@gmail.com or set up your own private consultation through my website, lalactation.com. Now you know.